Let's talk about how to prevent coning from diastasis recti. Coning is the cone-like bulge down the center of the abdomen right here that occurs when increased intra-abdominal pressure strains the linea alba. Typically, we see this in pregnancy during overhead movements, leaning back too far, any movement where the ribs are thrusting or flaring out, and core exercises that our core just isn't quite ready for anymore, like planks or sit-ups. One thing that we can focus on to be preventative of coning during pregnancy is our posture. When we have proper alignment, we are going to protect the integrity of our core even more versus standing like this, everything's compressed, shortening those muscles. Or arching, we've got that thrust in our ribs, they're flared out. This does not protect the integrity of that linea alba, and it allows more room for coning to happen. There's no engagement when we have misalignment in our posture. Next thing that we can do to help be preventative of coning is focus on our breathing. We want to practice diaphragmatic breathing. Rule of thumb is you want to make sure that your ribs are stacked over your pelvis. On our diaphragmatic breath, when we exhale, we want to make sure that those ribs come down. They're now stacked over my pelvis. This sets me up for an overhead press where my ribs don't flare. You can also use props if you need to help. I love using a ball between the knees to encourage that engagement so that when we exhale, we think about squeezing those hip bones together, picking that blueberry up with our pelvic floor because we're going to be able to control that intra-abdominal pressure more. Final way to avoid coning during pregnancy is unfortunately simply just eliminating those exercises. If you're experiencing coning during flexion, holding a plank, overhead press, but you know you're engaging your core the right way, you've got good posture, it simply just may be time to decrease the demand. At some point during pregnancy, there is going to be that natural separation, that diastasis recti that has to happen to make room for growing baby. So even if you are A+ student in core engagement, you're still going to experience coning at some point in pregnancy, and it just may be time to hang the hat on certain exercises until you are recovered postpartum. The good news is you don't have to be done with these exercises forever. You can heal your core postpartum and continue them from there on out. We'll talk about that next.